In this presentation, I will talk about the evaluation of the existing restoration or the restoration defects. Of course, there are so many, but I will talk about the most common ones and how can we evaluate them for the retreatment procedure. As any type of examination procedures, we should do our examination in a clean, dry, and well-lit field. And that should be done using the following sequence of steps that we talked about in the video of the caries diagnosis, using the using the history taking procedure, and then clinical examination, and then the use of the diagnostic aids. The use of the diagnostic aids here is mainly by the use of radiographs, of course, and the clinical examination is done using the inspection and tactile sensation by the use of the probe. And the history, the patient usually comes to you and tell you that he either feel that there is an impaction of food, or there is a difficulty in brushing or flossing his teeth, or during his eating yesterday an peanut, he felt that there is a chipping of his teeth, and during your examination you will see the defect and evaluate it. The first defect that is possibly present, that is called as amalgam blues. Amalgam blues are things or discolorations that are present when the corrosion products of the amalgam leach into the tooth structure. This is not a thing that needs a retreatment procedure, but if there is an aesthetic concern, you can retreat it. The second thing is the overhangs, restoration overhangs, that can be assessed visually or more accurately by the use of a radiograph, that needs a retreatment procedure, and that is because it leads to periodontal defects or diseases. Recurrent caries is a thing that we usually see in our clinics, and this also needs a retreatment procedure without hesitation. The other thing, which is ditching or gaps. Ditching or gaps are two names for the same thing, which is the presence of space between the tooth and restoration, and that is because maybe the restoration gets old, or because of chipping or fracture of the restoration, or because of the erosion of the cement at the margin of the indirect restorations, or maybe because of the recurrent decay that happens. The other thing that we have is the fractures that might be present because of that we do not follow the mechanical considerations during the tooth preparation procedure and putting of the restoration. We should always put the mechanical principles that we have talked about during the video of the principles of tooth preparation. They should be put in mind always, so that we will prevent the fracture of the tooth and restoration and gain the proper resistance form for both of them, preventing their fracture. Finally, we may have open contacts that will lead to food impaction, tight contacts that will prevent the adequate flossing procedure by the patient, and high spots. High spots usually happen after the doing of a restorative procedure, and they will lead maybe to periodontitis, apical periodontitis, or pulpitis and sensitivity to the tooth. Anyway, this thing is easily treated by a selective grinding procedure.